This is Andrea Dowd at Precision Sports Therapy Incorporated, and today we're going to talk about running injuries, especially the hip and knee. We are also going to learn about the causes of them, and specifically assessing the injuries, as well as we're going to learn some really fun exercises to make you a better runner. Alright, so the glute medius is a very important muscle for running. It's so important that I need to show you on this lovely poster where it lies. So it is a part of your butt. You have the big glute muscle, and then high up on the butt here, coming across over this way, is the glute med. Now it is a hip abductor, so this is hip abduction. You're taking your leg away from the midline of your body, and it also stabilizes the pelvis, and it's involved in making sure the knee does not go in like this. Now the problem is that most of us have sedentary jobs, and we sit in our jobs for 8 hours a day, and in here you have hip flexors, so you have what's called a TFL, Tensor Fasciae Latae. I like to remember it as Latae. And then you have the Rectus Femoris, which is a two-joint muscle. So if we look here, the Rectus Femoris right here is a two-joint muscle. And then we also have the iliotibial, which you can't really see on this poster, but it comes from the back around into the hip. So those become tight. Now what ends up happening is a lot of you are lunchtime runners because of constraints to time. So now you've actually tightened the hip at work, and now you go for a run. So the problem is you don't have any hip stability because your hip is tight. So now you're like this and you're running like this. And nobody really, when you run, you don't run like this. Nobody does this, because that would be impossible to run. So the other really important thing is when the glute med is weak, the TFL becomes overactive, and that's that little muscle right here. So if you were actually just take your hand underneath your hip and rotate back and forth, you'd feel something pop in. That's your TFL. And the TFL's job is to stabilize the pelvis at the end of hip abduction. The glute med initiates at the start of hip abduction, and when the glute med is weak, the TFL becomes overactive, and it does the whole, it tries to stabilize the pelvis in the whole abduction. Now again, if you don't have a glute med, what ends up happening is the IT band, which is down here, so the IT band is here, and you can see it attaches the TFL as well. And then here's the IT band over here, and again it attaches into the glute max over here, and then the glute med here. So the IT band, when it needs to stabilize the knee, it sends a message to the glute med, hey, I need your help. I need your help to fire. But if the glute med is like asleep and it's not working, it's like, hey man, I'm on strike. So then what happens is the IT band then has to stabilize the knee, and it gets tight, and you get what's called IT band friction syndrome. So the importance of the two, the glute med not only has an importance on the actual hip, but it actually has an importance on the knee as well, hence why it's an important muscle for runners. Okay, so I guess you're wondering now, how the heck are we going to assess the glute med? Like, how do we know if it's weak? So what we're going to do is I'm going to teach you a few little assessment tools that you can do. And I have my really nice friend Sarah Took from Sarah Took Fitness, Premium Fitness Services. And she is going to be my assistant for these assessments. So Sarah, why don't you show us a nice little walk that you do?
Okay.
So you may think that Sarah actually is a model on a runway, and you've probably seen people actually walk like this outside, and this is a big indicator of a glute med weakness. So most of the models on the runway actually have a glute med weakness. So the other thing we're going to do is actually we're going to get Sarah to stand on one leg and then the other. Okay, so turn and face this way. All right, Sarah, I want you to lift your right leg up. And you can see how this hip drops. So this is called a Trendelenburg. And the gait was actually called a Trendelenburg Gait. And then do the other side. So you can see how the hip drops. Now the other assessment tool that we can use is lay on your side, as we can actually test the muscle. So she's going to be laying on her side. We'll get the bottom knee bent, and the top knee is going to, the foot and the hip are going to be in line, and then she's going to keep her toe flexed like this. She's going to bring it straight up, so you're not forward, you're not back, you're not rotating the hip, it's straight up because it's a hip abductor. And then you're going to push up into my hand, so meet my resistance, and you're going to push up. Now if she's strong, there'll be no movement, but if she's weak, I'll be able to move her. And I have some big muscle guys that think they're tough, and they're like, yeah, I work out, but actually when I go to test them, they actually are weak because all they do is squats, deadlifts, and clean and press. So you'll be surprised at how many people have a weak glute med. Then the other one, which is actually an exercise they use for rehab, but unfortunately it's not a very useful exercise if you can't even activate your glute med. So the idea is it's called a clamshell, so I'm sure a lot of you have heard of this actually exercise. So we're going to bring her knees back, and she's going to keep her hip forwards. So you remember from the beginning when we found that TFL? So we're going to find that TFL again. And then if you get them to push up into your hand, so push up, you're going to be able to feel where the glute med is. So you're going to take one finger on the actual TFL and one finger on the glute med. Then they're going to pretend their feet are super glued together. They're going to bring this knee up, and you're going to feel which muscle pops into your fingers first. So with Sarah, her TFL pops into the actual finger first, and then the glute med. So that's telling me that actually her glute med is not firing properly, or it's underactive, and the TFL is becoming the most active hip abductor, so that sideways movement. Again, so those are 3 tests that you can do to assess, is a glute med actually working properly. Alright, so now you're probably wondering, how the heck do I fix a glute med weakness? Well, fortunately, Sarah has been kind enough to be my client again, and we are going to go through 5 exercises. We're going to progress them from, okay, you don't have a glute med, it doesn't fire, so we need to get it firing. And then we're going to progress it from a closed chain to an open chain to running specific. So the first exercise we're going to do is basically a glute med isometric hold, meaning that there physically is no specific movement, but we're just going to get the muscle activated. So we're going to have Sarah down on the floor, and her arms are going to be at her side because we don't want her back. She's going to engage her core, and then she's going to make sure that both her hip bones are going to stay on the floor. Then what she's going to do is she's going to grab her leg, and she's going to point her foot towards her head, and she's going to push sideways with her foot and ankle into the floor. So again, that movement, that hip abduction movement. And then she should feel a nice little pop up into here. So she should feel some tension up in here. She may feel some down in here as well, but it's generally in this area here that we're working. And she's going to get a nice butt for the bikini days. And it's also going to help stabilize when she runs. So this is if she is not activating her glute. This is the first exercise I would give her. So then the next exercise, we're going to use a ball. And she's going to lay on her side. Now we're going to start adding movement to the exercise. And we're going to put the ball behind her foot. And the idea is she wants to make sure that the hip, the knee, and the foot are in line. And she doesn't rotate back or forwards. And she's going to roll the ball up until she can't go any further, making sure that hip stays in line, she doesn't roll back, and then she's going to roll it back down. So nice controlled movement. And then back up. And you can see how she kind of like rotated back because she's trying to engage other muscles. So when you have a weak glute med, this is a progression. So if you don't have a strong glute med, then you need to start with the first exercise, because what will happen is you'll start to try and use other muscles to actually do this exercise. Yeah. All right, so you can see that Sarah has rotated her hip back, and that actually is not activating the glute anymore. She's trying to get other muscles involved because her glute med's like, hey man, I've been lazy for so long that now I got it. You want me to what? Work? Okay, well no, forget it. I'm going to let the other guys do the work. So we need to bring her hip back so that it's equal in a line with her knee and her ankle. So one big line. And then go. So see, she's rotating. So we got to keep her. There, that's better. Perfect.
How many times do you do this?
You can do this 3 sets of 10, but form is the most important. So if you can only do 1 set of 10 to start, that's perfect. And then work up to 3 sets of 10, but again, form is the most important thing. When you're ready. The next exercise is called the fire hydrant. And literally, if you own a dog and you see them lift their leg to go pee, they're working their glute med, believe it or not. So the idea is that you want to make sure that you have what's called a nice cylinder, and then you're going to keep this area here nice and stable. And what Sarah's going to do is she's going to lift her knees sideways and up. That's perfect. Now, a lot of times what happens is people do this, and we don't want this because then you're trying to activate more muscles to get this to isolate, to not isolate the glute med because it's weak. So again, we need to start at number 1, the beginning, the isometric hold. So come back down, okay, and then go again, and then back up. Perfect. So that's kind of what it looks like, making sure that this stays in line and only this moves, not this. So now we want to get a little bit more into single leg stuff, because running there's a point where you're in flight, meaning that when you push off, your leg comes through and you're only on one leg. So for stability purposes and for running purposes, so mimicking running, we're going to actually focus on that. So the first exercise is called a single leg deadlift. So the idea is that you're going to shift your weight onto one leg. You're going to make sure that glute is stable. You're going to bend your knee, and then you're going to tip from the hip. So this means tip from the hip. So you're going to tip from the hip like this. But you make sure your back is straight. So Sarah's going to tip down. She's going to tip from the hip. Yeah. And her hip is going up on the right, so we want to make sure we keep that hip level. But also, we don't want the actual leg back here to rotate out. We want it to keep it level like this. So a lot of people, what ends up happening is either this hip drops and she rotates, or this foot comes out. So again, go again, Sarah. So we're going to do it again. So Sarah's, and then her back is going to go as one, and that looks better. And then come back up. And it's a good thing Sarah works out, because she wouldn't be able to do this if she didn't work out. So she's an amazing fitness instructor. All right, so the next one is, again, we're going to start focusing on single-legged. So this one you may need a dowel, which is like a broomstick, to kind of hold your balance. So the idea is help up here, Sarah, is you're going to have one leg on a step. You can use a stair at home. So one leg on a step and one leg down.
And then I'll use you as my dowel.
Sure. And I'm going to be the dowel. And actually I'm going to go on this side to stabilize. Okay, so she's going to go down into she's going to start in a squat position. And then she's going to push up onto the actual hip on the step. So we're going to create some stability. Perfect. And make sure that glute and the core is engaged. She's going to stay upright, so no tipping. And then what she's going to do is she's going to take the outside leg, so open chain. She's going to take the outside leg and she's going to abduct it. Perfect. Now what may happen is she may rotate her foot. So she may like rotate her foot. So now we're getting the external rotators, we're not getting the glutes. So you have to make sure that hip is directly going out from the body and that she's not tipping. So stay a little more upright, Sarah. Okay, good. And then go. And then squat down. And then stabilize. And so she's kind of leaning. So the big thing is, I'm just going to show you, hop off for a sec, is a lot of people, if they don't have the balance, they're going to kind of do this, which is not good form. That's why it's really important to have something stabilizing you. Or they're going to like do that. So again, it has to be like that. And good thing I practiced that. All right. So I hope that you enjoyed this excerpt of running injuries, hip and knee. If you have any other questions, you can visit me on my website, Precision Sports Therapy. It's actually precisionst.ca. Or you can subscribe to my page. I'm going to start adding more sports injuries and assessments and how you can rehab them. Signing out for now, Andrea Dow, Precision Sports Therapy.
Go ahead.
Hi, this is Andrea Dowd from Precision Sports Therapy Incorporated.
What? Start again. Edit. Take two.
Reference to edit. As most of you know, people who run actually have hip and knee pain if they, actually hold on a second.
That's okay.
Let's cancel that. And I have my really nice assistant, Sarah Took from Premium Fitness and Services. Let's start that.
It's like if you're gonna say it, you gotta say it
Right.